by now you've likely heard the news about the leading decongestant used by Americans to treat that stuffy nose. The FDA voting unanimously against the effectiveness of phenylephrine. Say it again.
Phenylephrine.
Thank you. Basically, according to the government experts, it doesn't work. Yet it's found in many popular over-the-counter medications like Sudafed, Dayquil, and others. So what can you do to relieve your congestion? I have some right now. Joining me with some answers is Dr. Sanyal, a primary care physician at IU Health. I'm glad you're here to help me pronounce all of these tough words. I'm like, wait, what is it? But again, we've heard this now for a couple weeks. This came out, and I think a lot of people that have taken decongestion, they're like, I don't think this works. What is happening? Kind of tell us, so for those that didn't hear about it, what were the findings?
Yeah, so the FDA just said, you know what, we've been looking at the data and phenylephrine really isn't that effective. And us as physicians have kind of known this for a little bit of time. Anecdotally, everyone who's taken it has realized, this doesn't really work.
And now it's kind of finally official.
Right, right.
Okay, so let's talk about when we're looking at labels. Before we get into some of the things that do work, we're talking about things like maximum strength for sinus or allergy issues. What do you want us to know about that?
So I think marketing and labeling is important to recognize that it's really just that. So look at the back, look at the ingredients, look at what it's listed as, look at if it has certain ingredients in it, like phenylephrine, and maybe that's why they're calling it maximum strength.
Okay. Let's start diving into things that do work. One big recommendation now from the FDA is that nasal sprays are effective. I actually took one over the weekend. My husband's had allergies since he was a little kid. He goes, Ange, do you want to know what works? Let me hook you up. So what does work?
So nasal sprays do work. Oral antihistamines do work. Pseudoephedrine, another oral ingredient, does work. Something important about nasal sprays is there's multiple types of nasal sprays. So there's your corticosteroid nasal sprays. There's also something called Afrin. I think Afrin is the one that we want to be careful to not use for more than 3 to 5 days.
That's the one I took. So tell me more. I took it for, because I'm a freak about that. I don't like to, I'm like, wait, I don't want to put something in my body. So again, tell us about that 3 to 5 days max.
So the more that you use the Afrin for longer than that, you can get really bad, we call rebound rhinitis, basically a rebound runny nose.
Oh, yeah, we don't want that, because then you're not helping it at all.
Not getting better.
And again, is that really what is important on that warning label? What is on the warning label? Anything else that we should be looking for that says, hey, don't just be using this whenever you feel like you have a little stuffy nose?
Right. I think the main thing is, do you really have symptoms? Is it just a little bit of a symptom? Is it a bit of a runny nose or nasal congestion? Because there's other things that you can go to first, like nasal saline even.
That's a good point too. Anything else when you're, I'm thinking too with people when they have a cold or a virus versus an allergy, is it kind of, are you using or should be using the same thing, or does it really matter?
You can use them interchangeably. I think it just depends on how long you're using everything. So if you really have allergies and you really need to use it for an extended period of time, definitely worth a conversation with your doctor, but it's usually okay to use some of that stuff.
Every once in a while, and maybe if you can't sleep at night, you literally feel like you can't breathe, maybe one night it's okay to use it.
Absolutely.
Doctor, thank you so much. Great information. We sure do appreciate you. Good to see you again as always.
Thank you.
Jim O'Brien. I hear more of those sniffles.
I know.